Did you know that every 10 minutes someone dies from a blood cancer? Approximately 1.5% of men and women will be diagnosed with leukemia at some point during their lifetime. This may seem like a small number to you, but in reality, it isn't that small. My stepmom and grandfather both had leukemia, and just watching the toll it had on their life and body and the lack of information that people knew about it was truly heartbreaking. Most people seem to think that there aren't that many different types of cancer. When talking to friends, most could only tell me one. They said breast cancer, and that was the only one that came to their minds. I want more people to know that there are many different types of cancer, and even some cancers break down into subtypes. Leukemia is a type of cancer of the blood cells, and there are dozens of types, but today I will be discussing the most common four: acute myelogenous, chronic myelogenous, acute lymphocytic, and chronic lymphocytic. Acute myelogenous leukemia is a type of cancer in which the bone marrow makes abnormal myeloblasts, which are a type of white blood cell, red blood cells, and platelets. Symptoms of AML include fever, easy bruising, and a constant feeling of tiredness. It affects the way a person acts day to day. They may feel tired or weak, they may have a lost appetite, or they may have a shortness of breath. Chronic myelogenous leukemia, however, is a type of cancer that starts in certain blood-forming cells of the bone marrow. The leukemia cells build up in the bone marrow, ultimately leading them to being in the blood cells. A lot of CML patients also have a mutated gene called the Philadelphia chromosome. My stepmom had a Philadelphia chromosome. Acute lymphocytic leukemia, also called acute lymphoblastic leukemia, is a cancer that starts from the early version of the white blood cells, lymphocytes, in the bone marrow. Seeing my stepmom experience ALL, I know all of its lasting effects, and I have experienced it firsthand. It's truly terrible to see. She was so tired all the time, constantly throwing up, and had absolutely no energy ever, laying in the bed without eating or drinking anything for days on end. ALL is the most common cancer among children. However, it's what my stepmom had at the age of 27. This shirt is a representation of the leukemia cancer ribbon on it. The leukemia cancer ribbon is orange. Chronic lymphocytic leukemia, however, is a type of cancer in which the bone marrow makes too many lymphocytes. With CLL, a patient has swollen lymph nodes as well as extreme tiredness. They will also experience weight loss and fever. My grandfather had this type of leukemia, and whenever you would look at him, you could tell his throat was swollen and he was extremely skinny. All of these types of leukemia affect the way that the body helps itself. It makes the body more susceptible to infection. It's truly awful to watch this disease hurt someone. Seeing people close to me, like my stepmom and grandfather, go through this terrible disease, I know what it's like to see your family go through it, and I wouldn't wish it on anyone. All types of this cancer are treatable by a medical professional. However, not all treatments take to the body. My stepmom went through chemo and radiation, and it didn't help her body at all. But when she had the bone marrow transplant, her body started healing. My grandfather, however, started remission through chemotherapy and radiation. All bodies are different. There are many different types of leukemia, so it depends on the person as to how they will heal or how fast they will heal. In conclusion, you now know about the four main types of leukemia: CLL, chronic lymphatic leukemia; ALL, acute lymphocytic leukemia; CML, chronic myelogenous leukemia; and AML, acute myelogenous leukemia. They all take over the body in some way in which the blood cells and/or bone marrow are affected. Now you are informed about leukemia and some of its different types and the dramatic toll it can take on the body.